Welcome, everyone. We're happy again to have you join us for our update to the community on what's happening related to COVID-19. It is Wednesday, and we are a week away from, almost a little bit more than a week away from the end of the current Safer at Home order. We know that that's had enormous impact. We'll talk a little bit about that today, as well as an update on Wisconsin and local numbers of COVID-19 in our community. While the situation of COVID-19 is ongoing, we also know that many other things are happening in our community, and we want to acknowledge a couple of those today, and we'll talk a bit more about National Severe Weather Week and Severe Safety Week, so we'll talk about that a bit. I also want to take an opportunity today to thank our emergency communications and 911 team. It is a week where we celebrate that group, and nationally and locally, and the group of people that respond to our 911 calls and work on communication in an emergency situation are so essential in every community, and certainly when we have issues like this are incredibly important in how we respond to a disease outbreak. All of the people at the 911 office, they know my name because they call me in the middle of the night or at times where we have reported disease, and they are such a critical partner. So we are very, very appreciative of them and their commitment to our community. In Wisconsin, a status update, we now have 3,721 positive cases of COVID-19 from testing, an increase of 166 since Tuesday. We have 39,326 negative tests for COVID-19, and a total of 182 people in Wisconsin that have died from COVID-19, an increase of 12. Reported hospitalization is over 1,000 now at 1,091 individuals that at any point in time with their positive diagnosis that they were hospitalized. We really want to again thank everybody who's made the really tough sacrifice to stay at home. That public health strategy, the strategy to keep Circle as small as possible, is working. It's making a difference. We've heard from the governor and from the state health officials about that over the last week, and we are seeing, even in Eau Claire, that those numbers are flattening out, and it does make an enormous difference. The fewer people we come in contact with, the less chance we have of getting disease, and the less chance we have of giving disease to others. That's the point of the Safer at Home order. The initial predictions in Wisconsin were between 400 and 1,500 deaths by last week, Wednesday. We are now a week later, and again, we've had deaths, and every death is a tragedy for the people that are in those families. But certainly the death number is significantly lower than what would have been predicted if we wouldn't have had the order. It's a tough decision to make, really, really tough decision to use this public health strategy, but in order to flatten that curve this effectively, we needed to do something serious. The risk of more disease will happen when we start looking at ways in Wisconsin of opening up that order. The minute our circles become bigger, again, that same idea that we've talked about all along, as our circles get bigger, the risk of disease will increase. None of us is immune to this disease, so those people that get sick and have serious consequences, that will happen with opening up the order, and people that even don't get sick but then risk infecting others that are at risk is there. Today also in Wisconsin, the governor did sign legislation that was moved very quickly through the state legislature to bring some COVID-19 related funding and resources to the state. It does bring federal dollars in. It addresses unemployment benefits as well as another number of other measures that were positive steps forward that the legislature and the governor worked together on moving. In Eau Claire, we have 22 confirmed cases of COVID-19 in our county. That is 22 residents that have been tested and found to be COVID-19 positive. That's an increase of 1 case. Our testing numbers are at 1,361 individuals, county residents that have been tested. 1,258 of those are negative. The remaining are pending. So again, we're seeing testing happening, and we are seeing very small increases in positive cases. The range of ages for those positives, again, is wide. The call center did talk to 17 people yesterday as part of their response to this and making sure people are aware of what's happening. The calls have been going down, but I heard again this morning that there were significantly more calls at the call center again. So it's definitely dependent on where people are at and the kinds of questions that they have. Testing and positive case investigation and contacting all the people that were in contact with that positive case are critical parts of our public health response. We've talked about that before. We will continue to have to do that work probably for many, many months. The state is looking at strategies to make sure that not only testing increases happen, but also that we have the capacity, the ability to do that case investigation and that contact tracing. It's work that every local health department across the state is very used to doing, that kind of work for other diseases, but the numbers will make a difference. If we have an enormous spike in cases, that will take a lot more capacity to keep the circle of spread very, very small. The goal moving forward, we will likely hear from the state, as well as you'll hear from me, is to contain disease as much as possible. Safer at home has been a very critical strategy to contain disease, but as we look forward and as we know at some point those orders will be changed and lifted, then we need to really even more so understand that any possible positive, we need to test people, we need to get them to stay home, and we need to make sure their contacts stay home so we don't spread disease. We've previously talked about long-term care facilities and assisted living facilities, those places where people that are older or have a number of medical conditions that keep them in a compromised position and needing care are residing. Those places are some of the facilities where we've seen the worst impact across the U.S. and internationally for disease and death. Wisconsin is seriously looking at ways that we can continue to support success of our assisted living and long-term care facilities, making sure that they are meeting the needs of those residents and also making sure that we decrease every possible way that disease is spread in those communities. In Eau Claire, we're working very closely with our long-term care facilities and our assisted living facilities, email and meetings regularly with that group. We know it's really hard work that they do, very difficult work and critical work. Our older adults and those people with medically compromising situations need our love and support and care. They need the care of the facilities that do that work. While we're in this really difficult, unprecedented time, my ask to all those facilities is to take the strongest measures possible to prevent the potential spread of disease. We've talked about this before. We know it's hard, and we know people are really challenged with that kind of approach that I've asked those facilities to take because they love their family members that are there and they want to be with them. Our ask is that for the near future, they find creative ways to do that don't include coming on site. We've also continued to hear a lot about parades happening or being planned as a way for people to have some fun and have some socialization. Parades, unless they're for very narrowly defined purposes, are not allowed in the order. They are not essential travel. They are not essential businesses. We get why people might want to do them. We understand that people are trying to find creative ways to distract kids, to have some fun, to find some level of connection. But those parade opportunities create all kinds of challenges for potential disease transmission. And the communication really is that they can't happen unless they are falling under a very specific and narrow definition. People that have questions about that can certainly call our COVID hotline. The call center number is 715-831-7425. And then severe weather. We're fortunate in the Eau Claire area to have some snow. For some of you know that I love snow, although in April maybe not the best thing. But severe weather in the spring does happen. It is National Severe Weather Week, and while we had snow on Sunday, we may have tornado or other challenging weather in the weeks and months ahead. We hope that everybody takes some time this week to pause with their families and the loved ones, the people that they live with, and really think through with your household, what do you do in those situations when severe weather hits? What's your plan as a household, and how would you execute it? Again, it's something that's critically important. Our family, especially when my children were young, talked that through and made sure that we had a plan, and we really hope everybody is doing that. In Eau Claire County, we typically have a tornado drill during this week. We ask schools and families and individuals to really think through, by concretely having a tornado drill, what they would do in that situation. Because of the events that are happening this year, that will be a virtual drill, not an actual drill. No sirens will sound, but we are asking, again, people to review their plans, families and households to review their plans for what they would do during a tornado. So in closing, I do want to remind everybody to go to our website, coronavirus.echealthdepartment.org. That is a source of information for you about what is currently going on in our community. It is a place to link to all of the other reports and the resources that are available at a state and national level. And we want people to have good information, so please use that site. If there is something that you can't find an answer to at that site, please do call our call center number. That call center continues to be operational, and that number is 715-831-7425. 211 is also a resource that people in the community are encouraged to use, and 211 is a phone number as well as a website that you can go to and get additional information and resources there. We know this is hard. We want you to stay connected. We want you to have good information. We want you to help support across the community the intent of the work that we are doing, which is to keep the disease spread minimal, to keep people safe and protected, and to make sure that the impact of this really unusually challenging disease is as minimal as possible. We will continue to do these media updates. Our next one will be on Friday. And now I can answer questions that people have. Yes?
Lisa, can you be more specific about the restrictions related to nursing homes? Does that include, like, it does, I think, people not going up and communicating via window?
Mm-hmm. So the question is related to restrictions with nursing homes. There are a number of required restrictions for nursing homes and long-term care facilities that have been in existence for a while. So visitors coming into the facility, as an example, has been prohibited by the state. Nursing homes have a number of other measures that they are taking proactively to try and stop the spread of disease. We also have measures in place that once a case is identified in a nursing home, there's very clear guidance to walk and talk through how we control the spread of that disease. Nursing homes are also following guidance related to protecting residents from the staff who may be carrying disease without knowing it. So the use of personal protective equipment and the transfer of employees from facility to facility. In Eau Claire, I have asked additionally for nursing homes and assisted care facilities to really not create an environment for additional potential transmission of disease by allowing window visits. That is a strategy that creatively some people are trying to institute. The state on Monday did send out an updated guidance to all long-term care facilities saying that the Order 12, did not expressly prohibit this, and so we will not be enforcing visits via window at nursing homes. But my ask to all nursing homes is to not have it happen by policy. And I know that's very difficult on them. Family members are very upset, and I understand that. It's heartbreaking to not have those kinds of in-person visits happen. But we have example after example in this community and across the U.S. of well-intentioned people not being able to avoid opening a window, reaching out, touching people, and the risk to our residents is just too high. And we've seen countless deaths in long-term care facilities. It's not possible for most facilities to monitor or have staff available at every window where this might occur. So just the resources of our long-term care facility, we want them used in caring for the patients and the individuals that are residents there. And it is very, very difficult for them to do something like this without risk. And I'm really asking them not to do it. Yes.
Have there been, without identifying anybody, have there been any positive cases at nursing homes in Oakland or in Eau Claire County?
So the question is, are there any positive cases of nursing home residents in Eau Claire County? That's the kind of information that we don't provide due to confidentiality. And it is something that we are tracking carefully, obviously. The risk in those facilities is high, and that's why we want to make sure that we have every measure in place possible. The data at the state level also does not describe exactly where people reside when they are a positive outside of the county of residence. Certainly, if there's a large outbreak at a nursing home, that information very typically does get shared because extra work happens to control the disease at that facility level. But yeah, that is not information that we share around specifics. Yes?
You said you expect the health department to be doing contact tracing and testing for many months. Is that going to be sustainable for many months? Will you folks at the health department need more resources to do that, or is that something that you can do now alone?
Yeah, so the question is around capacity of the health department and our partners to do the contact investigation and the training over many months. One of the requests that is moving forward to the state legislature and at a national level is really increased resources to do that work. I've described in other calls that we really get no state or federal money, very little state or federal money to do that kind of work. It's really the capacity that we have right now to do disease investigation for all of the other diseases that we're required to respond to really doesn't happen typically through state or federal dollars. The increased volume for this is something that everyone is very concerned about. We were on a state call today, and Dr. Ryan Westergaard, was talking about the strategy that we're putting together at a state level to do that kind of investigation of cases as well as the contact tracing. So I expect over the next week we will have more information about the specific strategy and, frankly, how that will be funded moving forward. We have worked very hard locally to not only make sure that we have enough existing capacity in our communicable disease section, which is where this work typically happens, but we have trained a whole cadre of other individuals, health department employees and others, to do that work when and if we need it. So for the short term, we have a group of people that is readied to do the work, and we are definitely preparing locally for that as well, not just waiting for the state to respond. So really, how do we start thinking about all the strategies that we're employing now and how that may change over time? Or is this our new normal with what we have with COVID-19? Certainly for any disease, not just COVID-19, if it's a reportable disease, we're required by state law to do case investigation and contact investigation. That's one of the things that we do as the bread and butter work of public health, whether it's pertussis or measles or any other disease. For COVID-19, until we have a vaccine, I am confident that it will be a reportable disease and we will be required to do this work in the near future. So for the next year at least, I'm certain that we will be doing that, and we will have cases. It's again a disease that nobody has immunity to, so as testing is happening, we will have positives over time. So I don't expect that strategy will change. One of the things that we know really needs to happen in this area and across the state, and we are again, the state phone call today again reiterated that we need to increase testing capacity. So many of the larger health departments, and including Eau Claire, have been pushing the state hard to come up with a specific strategy for increasing testing and working with us to make sure that actually happens. We've heard, and I think everybody has heard, that we have capacity in the state for close to 4,000 tests a day to be run, but we know that that's not what's happening. That many tests are not being run at a state level. Lots of different reasons for that. We are analyzing that data locally, and we have a team that actually yesterday pulled together our results and where those tests are coming from, and we're working locally to really talk to our local providers about how to get those numbers up as well. So short term, we're going to be working on that. Long term, we absolutely will continue testing. We'll continue to do the case investigation work and the contact tracing. Very frankly, contact tracing is much easier under the Safer at Home order. It probably makes sense to everybody that if I'm a positive, the only people that are my contacts are the very few people in my household and the people that I happen to come to work with because I'm working on this essential service. The minute we open that up and we have people going out across their usual business, we may not have 5 or 10 people to contact as contacts of the case. We may have hundreds. So if you can imagine the workload of anybody that is coming across many, many, many people, those investigations can be incredibly complicated. One wedding with a foodborne outbreak, which is where we often do this, is the 200 people at that wedding we have to talk to about their food intake and their disease status as an example of how it works. So a wedding with a COVID positive person and 250 people that may be close contacts likely would mean 250 phone calls. So those are examples of why capacity makes such a difference. Yeah.
State of Michigan and Lansing, a huge protest rally today. Just curious in your take on that, as well as B, I saw someone on social media commenting on that, and there's speculation of when the governor may extend the deadline. And this particular individual was saying if the deadline was extended into May, he was up for having a type of protest rally in Madison. So just curious if you'd comment on the Michigan protest rally at all and potential efforts for something like that here.
Sure. So the question is, can I comment on a protest rally that happened in Michigan and potential for similar events happening in Wisconsin? I don't know about the Michigan rally. Was it related to concerns about continued safer at home-like orders?
I think Governor Whitmer is seen as taking, folks feel like she went further than they were comfortable with on a couple of the orders, and so it was seen as kind of a riling up.
Sure. So certainly across the U.S., there are varying opinions about the approach, the public health approach of keep your circle small through a safer at home order or other strategies. And so we are well aware of that, whether it's in Wisconsin or in other states, that people are concerned about that. I think the job of public health is to present the science about why keeping the circle small makes an enormous difference. Giving examples, like I just did about the foodborne outbreak, helps people to understand, I think, why these measures are important for a disease that is having an enormous impact and will continue for those most at risk to have an enormous impact. There are decisions that will have to be made about opening the community and the society back up in very strategic ways. But my response is that we have to do that based on science. We have to think through the consequences of reopening, which certainly will happen and importantly need to happen over time. But there are consequences to that, and putting in place public health measures that, again, contain the disease as much as possible once we do that is going to be critically important. And that means we have to have really good testing, and we have to have really good case investigation and contact follow-up. So those things are critically important. And then I think we have to have the public understanding that we are putting each other at risk if we make choices once the Safer at Home order lifts to do things that potentially expose our very vulnerable populations, and to find creative ways to not push vulnerable populations outside of our society and outside of our social connections, but do it in a safe way. Yes?
Going into that maybe just a little bit more, do you think it's a good idea for us, once that deadline hits, for us to keep that day, or are you guys thinking we should, extend it out even further until that more testing becomes available? Just kind of curious on your take on it.
Yeah, so the question is really, what is my take on the extension of the Safer at Home order or another similar order? I think we need to use every possible public health strategy to contain this disease until we get a very clear and convincing either treatment or a method for vaccination. I do also think that we can't keep society closed down entirely for long periods of time. We are looking at the data right now for Eau Claire County. We certainly are working with the state to come up with what are the best public health measures that we can take in order to slowly open up society and make sure that we are containing disease as much as possible. That will include, as I said before, really educating people, really making sure people understand the consequences, and then making sure that as businesses open up, they have the materials, the supplies, and the resources that they need to protect one another, and that we have measures in place to protect the most vulnerable. Ongoing issue of testing, which I said before, we need good testing so we identify people quickly and can contain disease. We need good tracking, again, the control of the positive cases and minimizing the spread from that positive case. And then having the personal protective equipment, the PPE, available really widely so that those people that are out in the community and that are doing the essential work where they may come in really close contact to people that are positive are not also exposed. The worst thing we can do is open this up and have our healthcare workers and our emergency service people and all other kinds of people exposed broadly and not have a workforce to respond. Yes?
You mentioned before, Lisa, and I read this earlier today, we're not testing up to capacity. Obviously, there's a need for it. Everybody acknowledges that. Can you tell me why? What are a couple of the hurdles?
Yeah. So the question is really around testing. Why do we think we're not testing all the way up to capacity? It's one of the things, frankly, that we're trying to figure out locally and at the state level. So yesterday and today, state phone calls and local calls about what are the barriers to getting to full testing. And there are a number of them. There are barriers at an organizational or policy level where big systems have put in place some strategies to only test following a certain protocol and to roll back those protocols and change that process to opening it up a bit more is a bit of a challenge in a large healthcare system. So we know that's one of the things that we're looking at right now. One when phone calls come in and people get triaged in or out of being tested. Right now, many people are getting triaged out and told to stay home when they're sick. And we're trying to influence that at a state and a local level to see if we can get some changes there. We also know that testing medium and personal protective equipment, PPE, for those people taking the tests, swabbing the individuals, and running the tests are a challenge. So it's part of the message about why we don't want people hoarding PPE, masks, and those kinds of things. We need, in order to do good testing, we have to have PPE available for those people that are taking the sample and running the samples. So if we don't have those supplies, there's also a challenge. So we're doing some work locally to find out exactly what the barriers are here to see if we can influence that. We are seeing not a steadily increasing number of cases being done, frankly. We're seeing actually a dip starting down of cases being run in this area, and we're not sure why that is. So we're working on that, and we have wonderful healthcare providers in this area and good capacity for the region to have testing done here, and we're confident that we'll make some improvements. Any other questions? Good. Thank you again. We will be back on Friday. We appreciate the time you take to listen to these updates, and I really appreciate the work across the community that people are doing to keep each other safe, to keep yourself safe, and to find ways to make it through this. It's difficult. We want you to know that we understand that, and try and take a deep breath, get outside and get some fresh air, and remember that in the grand scheme of things, we want people to be safe and healthy. So thank you.